Welcome and thank you for participating in the Trusted Coaches Verification Card Program. This video is designed to help youth coaches learn the signs and symptoms of a concussion and when to hold an athlete out of play. Expect to learn the protocol necessary to handle a concussion and what the effects are on the athlete's ability to return to play. There are industry-accepted standards that will be addressed throughout the video. This video is roughly 15 minutes long and concludes with a quiz.
Away. Hold it right where you catch it.
A concussion is a complex brain injury that largely is a functional issue, meaning that the brain has problems with its function after the injury.
It is a traumatic brain injury, and it occurs when there's a sudden impact, jolt, blow, jarring mechanism to the brain. It's a metabolic injury. It is not an injury to structure, and chemistry changes in the brain.
The brain has problems with its functioning, meaning how people think and how people process information after having an injury. Concussions are becoming more common. The incidence is increasing because of higher participation in youth sports, but at the same time we are recognizing much more that concussions can be problems, and so we're looking for them more as well, causing the incidence of the diagnosis to go up. We most commonly see concussions in the collision sports, so football, ice hockey, wrestling, sports where athletes intentionally go at each other, but concussions can really happen in any sport. We see them in a variety of sports, including ones that don't typically involve contact with other athletes. An athlete does not have to be unconscious or lose consciousness to have a concussion. The majority of concussions happen without the athlete losing consciousness. Anytime a coach suspects an athlete of having an injury such as a concussion, number one is they should remove the athlete from play. What they should do is a quick observation of the athlete, looking for any concerning signs or symptoms. Certainly any what we call neurologic deficits, meaning one pupil or the black part of one eye is a little bit larger than another side, any shaking or anything that looks like a seizure, loss of neurologic function, meaning loss of control. Those are worrisome signs and symptoms. Those are things where you'd want to immediately have the athlete seek medical attention. But other things the coach can do is just question the athlete on what just happened. Do they remember the play that was just run? Do they remember where they are currently?
Ask memory questions. Some of the questions that I ask are, what did you have for lunch today? Because they'll have to think about it. May ask, what's your mother's maiden name? What's your grandmother's name? We give athletes words to remember. So typically they're given 3 words. You can use whatever you want, but pick 3 words and tell them, I'm going to give you these 3 words and I want you to repeat them to me. I'm going to ask you for them again, and I want you to repeat them to me when I ask you again. When a concussion occurs, it affects emotions, the areas in the brain that regulate emotions. So that's why athletes will start crying after they have a concussion. You always know that you have a concussion when you go in the football locker room and the big lineman, who's always tough, is sitting there crying. So it's emotions, it's memory, and it's cognitive reasoning or thinking. So that's why we check those things when we do our evaluations. We check those 3 areas by a series of different questions that we ask.
Anytime a coach or parent suspects an athlete of having a concussion, the number one thing they should do is remove that athlete from play. From there, that athlete should be closely monitored for any changes in their symptoms over time, particularly the first several minutes to several hours.
After you've removed them from play, you need to watch them, and you need to make sure that they're not going to go back in. Concussed athletes sometimes don't know where they're at, don't understand what they're doing, and they'll just run back out onto the field and start playing again because they think they should.
The next thing is that athletes should be appropriately evaluated by medical personnel, whether that be an athletic trainer covering the event, or that athlete should be directed to an appropriate medical provider. In emergent or urgent situations where there is any change, rapidly evolving symptoms over time, then that athlete should be directed to an urgent care or emergency room. Otherwise, oftentimes we will ask coaches and athletic trainers and parents to direct those athletes to see either their primary care provider or a sports medicine provider for further care.
Kids get kind of freaked out, you have to maybe calm them down. It's important as a coach that you're the one that's staying calm, and that you're also, even though you may realize that it is a concussion, that you're not over exaggerating the extent of the injury to the parents or to the other kids, but rather just making sure that they're staying safe. So it's always important to keep any injured athlete safe.
Anytime an athlete is suspected of having a concussion, the parents should be notified right away. If the parents are not in attendance, a phone call should be made to them, letting them know that their child has sustained a concussion and that they should be directed towards obtaining further medical care.
When you're talking to parents, just make sure that they know this is what happened, this is what I observed, so they have a starting point of what you saw, and then tell them to continue to monitor them and follow up with their family practice physician or a sports medicine physician if they have one in their area. In regards to return to play, an athlete should never participate in a sport again until all their symptoms are gone. So that's number one. All symptoms have to be gone. So there are 22 widely recognized symptoms, and you can get access to those symptoms or a series of those symptoms on a lot of websites in the CDC and many different resources. So there are about 22 widely recognized symptoms.
Concussion signs and symptoms reported by coaching staff. Appears dazed or stunned. Is confused about assignment or position. Forgets an instruction. Is unsure of game, score, or opponent. Moves clumsily. Answers questions slowly. Loses consciousness. Shows mood, behavior, or personality changes. Can't recall events prior to hit or fall. Can't recall events after hit or fall. Concussion symptoms reported by athlete. Headache or pressure in head. Nausea or vomiting. Balance problems or dizziness. Double or blurry vision. Sensitivity to light. Sensitivity to noise. Feeling sluggish, hazy, foggy, or groggy. Concentration or memory problems. Confusion. Just not feeling right or feeling down.
Given the potential for disabling symptoms and disabling mental issues that can happen from concussions, however unlikely they may be, concussions can certainly be a serious problem. In the long term, concussions can cause problems with brain functioning. It can lead to mental health issues in the future. There is some early research going on with long-term structural brain issues, although the evidence isn't conclusive yet on whether multiple concussions can cause long-term brain problems. So anytime a coach suspects an athlete of having a concussion, they should err on the side of caution, and that athletes should be removed from play. Coaches should certainly have a very high index of suspicion for a concussion. Anytime an athlete is suspected of having a concussion, they should be removed from play, and the typical advice is, when in doubt, sit them out. To be returned to participation, the athlete should be cleared by an appropriate medical provider, such as their primary care physician or a sports medicine physician or the like. They should have written documentation stating that they were seen for this injury and that their symptoms have then resolved. Once an athlete's symptoms have resolved, they then go through an appropriate return to play progression to make sure that they can get back into the sport safely. The return to play progression involves a number of steps, the number one of which really is rest. We ask athletes to rest both from physical activities, so certainly resting from the sport that they're involved in, also resting from other things. For example, if they're in school, they should rest from gym class or any other sports or activities that they are involved with at the time. The other type of rest that we ask athletes to do is cognitive rest, meaning resting from overstimulating the brain. Things like bright lights, loud noises, so movies. We ask them to rest from screen time, so spending a lot of time in front of the computer or on tablets or phones, putting down electronics. So the phrase that I like to use is make life as boring as possible. That's what rest involves. Beyond that, there are a number of steps that the athlete goes through for return to play. The number one of which is light aerobic activity. For example, we'll have them do 5 to 10 minutes of a brisk walk or using an elliptical machine or a stationary bike, just enough to get their heart rate up such that they can stimulate themselves a little bit and see if any symptoms come back. If symptoms return with any of these return to play steps, the athlete should then rest until those symptoms resolve.
And you have to test them out. With activity, are you bringing on any of those symptoms? If you bring on symptoms, rest a day, start back at the first stage.
If they pass that first step without having any return of symptoms, then they progress on through a number of additional steps, the next one of which is increasing their aerobic activity, for example, more vigorous jogging or running. Beyond that, step number 3 is they get into sport-specific activities, so doing non-contact drills, perhaps doing some moderate intensity weightlifting. If they pass that, again, without having return of symptoms, then the next step is full contact practice, where they can go back into a supervised setting, back into a practice setting where they can compete with the other athletes on their team, again, making sure that no symptoms return. And if they pass that step successfully, then they get back into full contact games.
So it's a slow progression back. So typically, if it is a routine 80 to 90% injury, you can expect an athlete to return to play in about 2 weeks. Preventing concussions is a little bit different than preventing other injuries. Really, the key thing to preventing concussions is preventing the things that cause them.
Certainly, number one is to limit the contact, particularly that happens during practice, especially in collision-related sports, again, football and hockey. Number one is limiting the amount of contact that happens during drills in practice. Number two is certainly emphasizing proper technique, especially again in those collision sports, not allowing athletes to stick their neck out, so to speak, and sustain some of these injuries. So proper technique is extremely important. There are a variety of protective equipment devices that are on the market. A lot of them will make specific claims about concussions, but there really is no protective equipment that truly can prevent a concussion. Certainly, helmets in a lot of sports will be protective for a variety of injuries, lacerations, skull fractures, but no device that's currently on the market has been truly proven to prevent a concussion. Same thing is true of mouth guards. Mouth guards are excellent for preventing dental injuries, but they do not prevent concussions.
The only prevention to concussions is preventing those things that would cause them, which is the blow or the jolt or the fall.
Concussions are not just something that we take lightly anymore. In the past, terms like getting your bell rung, having a dinger, were used to describe having a concussion. But the more we understand them, the more we understand they can be serious and disabling injuries.
So it's important that we don't take it lightly. If an athlete has a concussion, it may resolve pretty quickly. It may be 8 to 10 days or 7 to 10 days, but it may be days, weeks, months, maybe even years. And it doesn't just affect what happens in their sport life. It affects academics. It affects how they interact with other kids, with their parents. It's the brain that's affected by concussions is part of their who they are. So it's very important that we take it seriously and we try and help these kids and don't let them believe that this is something minor, because they may not be truthful about it. We all just need to be on the same page and make sure that everyone understands the severity, make sure that everyone is honest, and it can resolve with good identification and just managing it correctly.
Parents and coaches can certainly go to their healthcare provider, their athlete or their child's primary care physician, or a local sports medicine physician for more information on concussions. They can also go to the Center for Disease Control, or CDC, has some great information online in their Heads Up program.
Trusted Coaches, in cooperation with the Institute for Athletic Medicine, encourages you to know your state laws regarding concussion. For more information about state laws, visit www.trustedcoaches.org. Trusted Coaches and the Institute for Athletic Medicine should be deemed as a resource only and should not be substituted for actual medical care by a licensed medical practitioner. Thank you for watching the Trusted Coaches concussion video. The next step in completing your verification process will be to pass the online quiz. Additional resources, including the Center for Disease Control's Heads Up fact sheet and other materials related to concussion, are available for you to download from www.trustedcoaches.org. Thank you and good luck with your quiz.